So today I'm going to be talking about primitive reflexes and what it can look like if a child kind of keeps those reflexes from integrating. So most of the reflexes that we see should be integrated by 12 months. And so sometimes when kids come to us, we see that they're not integrated yet, and those can cause some difficulties with attention to task, sitting upright in a chair. You can see kids leaning over their paper while reading or writing. You can have some difficulty with reading, and then also just movements of upper and lower body together, and some bilateral coordination, or kids not crossing over their midline. So I'll kind of go over a few activities that can help kind of integrate those reflexes that you all can do at home. So the first one, I'll use the stick. So this is kind of for one of the reflexes that we see most, ATNR. And so what you can have your kid do is just have your kid hold a bar or anything where their arms are straight out, and then have them look at something towards the wall, one side or the other, and you're gonna wanna do both sides, so switching off the sides. But you'll just have them look at one thing and then kind of march. And you can do this first just standing still, and then once they get that down, you can start having them walk as well. But again, you'll want to do that with their heads turned to both sides. And then the second thing that you can do is, I'm going to show it standing, but you'll probably have your child crawling, is have just a small ball. This is just a tennis ball, and you can kind of get it underneath of their chin. So your head's turned to one side, just like the last activity, with the tennis ball tucked under your chin. And then you can have just your child crawling on the floor, trying to keep that ball tucked in underneath their chin. And again, you'll want to do that to both sides. And then just a few simple things that you can do is anything on hands and knees. So if they're doing a puzzle or coloring on the floor, just on their hands and knees. Tall kneeling, coloring on a wall, or just even side sitting, anything like that can also help integrate those reflexes.